what I was saying. But if you do want to get in touch to find out a little bit more about some of our organisational learning, then I've put my contact details up on the slide. So thank you very much.
Thank you very much. Also thank you for all the speakers basically trying to stay in their time slot. We've unfortunately lost some time because of the technical issues, but I would like to open up the floor now for questions or remarks. Can you maybe put back Marika on the screen? So, who can I give the microphone? Or let me ask, first maybe, do the authors want to respond to some of the comments in that respect? No, not necessarily?
Yeah.
Okay.
A few words and you're next.
Yeah, thanks a lot, Stummvoll. And thanks also to the commentators of Marika and also Harry and Rai. Very inspiring ideas we heard from you. I was just wondering whether we could, let's say, expand a little bit the introduction of the paper in the next option, because we try to integrate some of the thoughts, or we should consider to integrate some of the thoughts from Rai and Harry and from Marika. I'm not sure about that. Maybe we could do that in the German first, in the German translation or the German version of it. However, I think you made the thing quite clear, Marika, in, let's say, distinguishing between the quality standards and guidelines. So it's very important. And we learned a lot from Ryan, from Harry, how, let's say, any intervention should be planned. And I think we covered some of the key topics already, but there were additional ones which came up from the two presentations from Harry and Ryan on, let's say, the concrete process of how to implement. We did not focus and stress that much on the hows. We did a lot of work on the whats and whys. But this is left up then to the implementators, to the practitioners, to look after, let's say, appropriate, culturally and politically probably also oriented concrete interventions. So this is the next step. We only deliver the baseline for, let's say, ongoing processes. And yeah, thanks to the inspiring words of the three commentators.
Ciao Marika, Franca. I have a question for you. I like really very much, I found your comments very useful. As you mentioned, one maybe the most critical quality standard is the 3D assessment. And you mentioned the situation in Italy. We intend, as partners of EPPIC, to spread the quality standard in Italy, to organize an event in Rome, in order, because we think that we need these, they can be useful. But I am also very worried about the assessment. So I ask you if you have any suggestion in order to avoid the cherry picking that you mentioned, because I think that you referred before, people here probably don't know that in Verona we had a project that is, I think it's just started, testing young people at the secondary school for drug and alcohol. That is really, I'm really worried about the use that some professionals very well know in Italy can do of this. So any kind of suggestion in order to avoid this misuse of the quality standard are welcome. Thank you.
Am I expected to answer now, or?
You may respond, yes, why not?
Okay. I got the impression that also the previous speaker posed a question about how to create synergies for implementation I strongly believe, I heard that Harry talked about the policy level, which is very important. I strongly believe in the practitioners' power to implement standards if they feel, as also Ray said, if they feel that these are improving their life. So the synergies would be to apply all our knowledge we are carrying on based on the standards on prevention, some training of trainers opportunities, not only in Europe, but also in the neighboring countries. And I think in each of these events, we learn something from the practitioners. The point now, it's a challenge for us, is how to transform this experience or anecdotal reports into something that can be used across the different countries to improve the implementation. So it's I'm answering to some extent with a question. We are creating now this experience. What is the further step to appropriate implementing? In one of my previous lives, when I worked in Rome at the Public Health Agency, we carried on implementation of clinical guidelines, really step by step. At the closer to practice level, we went to hospitals and we had meetings with, for example, nurses. And then we asked them to commit themselves individually. What is your next step to implement this? It was a very capillary work, much intensive, but it was also very, very rewarding to see these people overburdened with work that is still willing to work and implement. So my answer is I strongly believe in synergies, but also on a bottom-up approach. Franca, once on another life of mine, my first thesis was on the judicial systems for minors, and I have to say that as often happens in Italy, it's theoretically is a very good system. For example, minors, at least at the time, did not go to prison. They were taken care in some family-shaped environment where they were followed up by social workers, and then only in this family environment they could be interviewed by a judge, for example, le case famiglia. So I think there is still a very healthy, fabric to try to convince practitioners to implement these type of standards. Probably the first step to sell them as a package is a so-called the leap of faith. So tell them, take all of the 10. You will feel resounding some of them, less others, but believe that they are a system. You cannot take one out of the others. In terms of the screening, so I don't know if I'm answering your question. Yeah. In terms of the screening for drugs and alcohol, we had a publication a few years ago because I had heard that there was this, in good faith, people. I received some questions, for example, from Hungary, saying, no, but it's good because it should, first of all, prevent young people from using drugs because they know that they will be tested at school. And then you really can see if you can help them. So I asked them, but if you know that you will be tested, what will you go? Will you go to school? Probably not. So are you preventing those that are more in need to go into school? Maybe. So we did a systematic review of evidence, proving that not even in a sport environment, drug testing has any effect. So I think this is my answer. And personally, I think one of the immense value of prevention, one is not to be so controversial. Probably people with the experience of Harry won't agree with me. But if you take treatment and harm reduction, you see that everybody agrees that you have to do something on prevention. So it's a very fruitful environment to promote evidence-based interventions. But one of the most amazing added value of prevention is that it's showing to us that you don't need to address individual drugs. You don't even need to focus specifically on drugs. What you have there is people with some problems. Some are transitory problems, some are more structural problems, and you can help. And once you start a virtuous, I'm thinking, Harry, to the good behavior game approach. When you start inspiring a positive change, then results comes, and less use of drugs, less violence come without focus, without preaching young people on drugs. So I would say that testing for drugs is the same thing. We are giving full attention to one problem that cannot be the main problem. Maybe the reasons for being in the judicial system, although now I'm referencing one of my colleague, Brendan, who works on the laws and criminal system, that said that rarely people goes to prison for use of drugs. In general, they have other parallel crimes, including trafficking, including stealing, etc., etc. So this is really to be seen as one of the outcomes, not the main problem. I don't know if I answered, Franca.
Yes, thank you.
I know I think you want to comment, and then I have somebody here.
So Vibeke raised a very important point of how to continue with these quality standards. You asked whether and how the MCDA could be helpful. I mean, it's in general a question to all our partners here. Is there some funds, some resources to translate them? Is there anything which can assist to make it sustainable in a way, or to, let's say, to revise it in a few years? So I think we should make up our minds on that particular question as well, and not let it be as a standalone, as we have so many standalones and so many European projects. So the project is done, and the website is turned off, and so I would have some suggestions for that, for the website, and to make it more sustainable. For instance, we are presenting the standards on a German conference in September. Yeah, that's a very important question you raised, Vibeke.
Thank you.
I have questions to Heiner Group. You were mentioning about standards, you were talking about lots of professionalism and holistic approach and cooperation and so on. But I'm wondering, you were dealing with the inmates or with the people who are incorporated in the criminal justice system, and you were talking about professionalism. Do you believe that every part of the criminal justice system can be professional? Do you think that a judge, policeman, prison officer can be professional in his work and can be the factors of the help chain in the system? Do you think that what is this professionalism in the part, right? Because the policeman, the prison officers played a different role in the system, and do you think that they can help, or they're only the best professionals, the kind of external person without from external system? What do you think about that? That's not my first question. Second, you were dealing also with standards. Did you measure how the standards will play a role and those are problems to implement those standards in countries across Europe? Because there are some countries who can implement it easily and who can say, yes, we did it, and that's good, and it's simple for us, and there are some countries that they say, no, it's very difficult for us to implement it because we have lower needs, lower part of needs when we're thinking about our policy, about politics, etc., etc. So that's my question.
Just very briefly, yeah, and everybody, I think, involved in the criminal justice system is in a way professional, or has a professional code at least, to which he or she can refer, to ethical code, whatever, professional code. And coming to the prevention system, I'm fully convinced that a very meaningful prevention can only be done by people from outside, external NGOs. They have a plus on trust and confidence. They can also yeah, they're more trusted in any way. So when it comes to very sensitive issues like drugs, sex, and other issues, which cannot be discussed in a way with people who are paid by the state and who might have an influence on the record and the future sentence of the people. So I'm fully convinced that professionalism from outside should come inside, and prevention worker, they as well have now a code of standards, like what Harry said is, for instance, avoid the deficit orientation, which is basic. So we come from a very positive emphasizing point, and many other things which are in the canon, in the structure of the ethical code of prevention workers.
Actually, your question about the police and made me think of your remark yesterday about harm reduction. And one of the quotes that you presented from, I think it was, or maybe you, it was this young woman, 15 years old, I think it was in Poland, being arrested, had to strip bare. I think that's, really sort of a trauma reduction system that we, in a way, all part of. But the question actually that comes to my mind now, don't we need, like, similar standards for ethical drug policing? That's a question I'd like to maybe throw into the room. I don't know if anybody wants to respond to that, otherwise,
Thank you very much. Again, I would like to express my concern about Standard 10 when you claim whose outcome would be interventions and services that respect human rights and the law. There's a number of countries where these two things are in conflict, and sometimes professionals make dramatic choices between human rights and respecting the law. So perhaps not in EU, even though in EU too, but in many countries this might be a standard that might be used by those who violate human rights that respect the law.
I think we're going towards the last question.
Just a very short reflection from Austria also on this development of standards, and maybe some feedback from our discussion in Austria with practitioners. And also I think that this distinction between standards and guidelines is very important. And it is important because we think that the standards address a much more general level. Our practitioners said, yes, of course, we can subscribe to all these different standards, but we won't have to change anything in our practice. They apply. But what I think is that it depends also on the political system on which level we address these standards. In Austria we have, in this particular sense, a very centralized system. The Federal Ministry of Justice gives out an authority to all organizations who want to offer a service. So all services in drug prevention that have something to do with the criminal justice system must have an authorization of from the Ministry of Justice. So I think the standards are particularly useful for the ministry, or on a general level, because the ministry has already developed guidelines for these practitioners. For example, also for prison services, and that these are much more specific. For example, they address the transition management of young people with drug problems who have to come to prison. So how do you treat those people in a special way? And also the release prevention, preparation, the preparation of release from prison. There are also guidelines for that given out by the ministry. But these standards, I think, they address the ministry and not so much the practitioners. That's just what the feedback that we got from our Austrian practitioners.
Thank you very much. I think Well, let me first excuse for the time problems that we had with technical stuff, but I do want to thank all the speakers and commenters very much for their contribution. I think it was very worthwhile. I think in the next session we go a little bit deeper in what's the follow-up and what can we do with this. I'd like to ask you now, people from the project, the partners, to stay here and everybody else can get their coffee. And let's try to make up a bit with the time so that we're here back around maybe, what is it, 11:35. Is that fine? Okay, thank you very much for... Thank you very much for joining us. Yes.
Thank you.
Thanks so much.
It was different with yesterday.
Sometimes you know
guidelines and policy standards. I would like to refer you to, for example, technical interventions, infections and diseases, probably the most quoted reference. There are 15 interventions. It's quite comprehensive. To take all these
I
Now we're close to the microphone, so nothing happens. For the moment we'll be close today, but we had the fund, so nothing works. We don't do anything because only people concentrate on
because we see
So all partners, we're taking photos now, and we're going to go outside and we're going to go down the stairs and have it. Yes.
Ministry of Health is responsible for health facilities in Queensland.
Was it? Yes.
What we want to say at the moment is that it's better to have the other parties involved. It shouldn't be concentrated, it shouldn't be only the responsibility of the Ministry of Health.
Go for the photo. Yeah, give us the photo. Sorry. Thank you very much.